Right. So the poll is done, and we'll be getting started now. You guys can see the results. We have a lot of people here from Sindh, and I think the majority, 75%, want to pursue surgery as well. So starting off, we'll be introducing the panel. I'd like Ronika to start this off.
Hello, everyone. So from Pakistan, we have Dr. Yasir Rashid, who is originally from Lahore. He graduated from AKU in 2014 and completed his house job from Jinnah Hospital, Lahore. Later, he did his general surgery residency from Shaukat Khanum Hospital, Lahore. Currently, he is a urology resident at AKU. Besides work, his interests are cricket, politics, and working as a volunteer for community healthcare. He is the co-founder and managing trustee of Humanity Initiative. He aims to set up affordable but quality healthcare centers across Pakistan. We also have Dr. Ahmed Bashir, who is also a graduate of the AQ class of 2014. After doing his intern year at Lahore in 2015, he cleared his FCPS Part 1, gave his USMLE Step 1, and joined AQ as a surgery resident in 2017. He is currently a PGY4 in urology, a field he decided upon back in second year of medical school. Having gotten married right at the beginning of residency, living away from home with a beautiful wife and daughter, he's really content and happy with how life as a surgery resident has played out for him. Over to you, Musa.
So next up from the UK, we have Mr. Ahmad Khan, who is currently Chief Resident at the University Hospital, Southampton, and ST6 in neurosurgery. He completed his MBBS from AKU in 2010, followed by an MSc in Integrative Neuroscience from the Imperial College of London with distinction. He subsequently completed his foundation training in London while simultaneously gaining a second master's in medical education part-time. He then went on to start run-in through training in neurosurgery in Southampton as currently chief resident for the entire hospital, a trust leadership position backed by the Faculty of Medical Leadership and Management. From the US, we have Dr. Sarosh Sohail, who graduated from the AQ class of 2015. She's currently training at the Montefiore Medical Center, which is associated with the Albert Einstein College of Medicine in New York, as a general surgery resident, PGY3. She did her preliminary surgery as a PGY1 and 2, and then last year she completed a burn surgery fellowship and is now continuing her surgical training as a PGY3. Dr. Anam Owais will be joining us later because she had some work to do today. So when she joins in, Ronika will introduce her. So without further ado, let's get started. I like to talk about some of the ground rules we'll be covering for this discussion. Number one, I want to clarify that we'll be focusing on life as a surgical resident, and we won't necessarily be talking about pathways into surgical residency or how to go about applying for residency in a specific country or hospital. Well, and if you guys have any questions, we have three members of the SIG general body here, as they've basically signed up as their names are ask your questions here. If you guys have any questions you guys want to forward, please message them in the chat. So starting off, our first question is pretty simple. It's basically, why did you choose to do surgery, and how certain were you when you made that decision? A lot of people here right now aren't very certain, or indecisive about the fact that if they want to pursue surgery or medicine. So we really appreciate hearing from you guys about your experience here. Dr. Ahmed Bashir, if you could start off.
Assalamu alaikum everyone. I hope all of you can hear me loud and clear. I'm thankful to SIG for having us here. Masud, could you just make it clear how long I have to answer this question?
Just take a couple of minutes. You can, I guess, 2 to 3 minutes.
Right. So I'll just keep this about myself. And while doing so, I would just like to point out a very interesting observation for all of you students, especially in the first 3 years. When you guys are at AKU, I personally feel like the default choice for most of you, because of the pathway that everyone else is following, of USMLE to the States, the default choice automatically becomes medicine as well as its subspecialties. But that's just my opinion. However, so people who actually do want to pursue surgery or surgical specialties, they need to have a very, very strong passion to pursue any of these things. And for me, it was more of a personal choice. I mentioned in my intro, it was second year when I decided on urology. And some of you who've been close to me might even know it was only based on a personal history of renal stones that I used to have right from my A levels. And it was just renal module scoring well, the clinical skills sessions being relatively simple, and it was just getting to know urology as a field that was very holistic and very simple. So it was a choice made for me by pretty much what I had been around. The only thing that I actually had to decide to actually set on this track was to get the default mindset out of my head. And so that's how I ended up there for urology.
Right. Dr. Yasser, do you want to add anything? Your opinion?
Assalamu alaikum everyone. Thank you, Musab. So basically, just adding on what Ahmed said, yeah, I kind of agree that a default pathway, at least in our times in AQ, was considered to be, just taking steps and joining an IM residency in US. So it was always one of the most important questions that are you not going to take that pathway? About surgery, why choosing surgery, it was more of a decision between two specialties for me, and both were surgical specialty. One was ophthalmology and the other was urology. I know they are far apart, but medicine was never my thing. And especially I had my undergrad rotation. Those of you like Ahmad Bhai and Sarosh may remember Junaid Patel Sahab. So Dr. Junaid Patel was the one assigned to me back in third year as well as in final year, and he was famous for his 6-7 hours morning rounds on the IM patients. And it was pretty hard, to be honest, to consider myself doing that all my life. So one of the things that helped me make my decision was not liking the medicine pathway at all. And that kind of helped me make up my mind that yes, surgery is the way to go. And when I decided that, for sure, was in the undergrad rotation. That was again with two amazing at AKU. One was Dr. Talati and the other one was Dr. Raziuddin Biabani. Both are still at AKU, and they were both amazing. Dr. Talati and Dr. Razi were, I think, the reasons I at that time thought that I should be going on and doing urology in future.
Yeah. Interestingly enough, I also had like 6-7 hour rounds in IM. That kind of also put me off from doing internal medicine. Mr. Ahmad Khan, do you want to add anything?
Thanks, Musab. Assalamu alaikum, everyone. I think for me, neurosurgery, there were two reasons why I wanted to do neurosurgery. One was a personal reason and the other was professional. At a personal level, my mother had a pituitary tumor. Fortunately, it was benign when I was 10. And her surgeon, so I grew up in England, London. I was a teenager when I moved to Pakistan. So I was 10 at the time, and in London, in Queen Square, one of the founding fathers of endoscopic neurosurgery, Mr. Powell, operated on her. And I remember he was very competent and a very impressive personality. And I thought at that point, when I grow up, I want to be like that, someone who can help other people and, provide sort of a quick fix, a surgical cure, as it were, for a disease. And that's why I got interested in neurosurgery. Even before I wanted to do medicine, I thought neurosurgery is, what I'd be interested in when I'm older. And at professional level, when at AQ, I was involved with quite a few projects with now Professor at Trianon and Dr. Hassan Bari, who both are still there. And they were very competent and impressive and great teachers, very knowledgeable. And I realized that neurosurgery is a great mix of both the academic side, which I've always been interested in research, but also cutting edge technology. And there's so much that we still don't know about the brain, and neurosurgery is an ever-evolving, expanding specialty. So it just really drew me to it at a professional level as well. So I think those are the sort of reasons why I chose neurosurgery.
Right, that's really interesting to hear, both personal and professional reasons. Dr. Soro Sehel, do you want to tell us about your reasons for choosing surgery?
Hi guys. So before coming to AQ, I had loved surgery, but obviously many of us who come into medical school want to do surgery. And then I did that elective that everybody does with Dr. Saudat Fatmi, cardiothoracic surgery. I was like, oh my God, surgery is so cool. But the reason I actually wanted to do surgery was because of the anatomy. I loved the whole concept. Even in my O and A levels, I would love the part where we would do dissect, like, frogs and everything. And I would like later go home and show it to my parents and they would be disgusted. But that is the aspect that attracted me to surgery. But the real reason I wanted to do surgery was that when we were doing our rotations in AKU, seeing that quick result and that gratification in the patients and their families' eyes really drew me in. I know in medicine as well, that's sometimes the case, but you go in, patient has a lot of pain, for example, simple appendectomy, and you remove it and the patient's like, fine. All that attracted me a lot. And big surgeries like surgical oncology, curing patients of tumors, all these instant fixes is what I was drawn to. And the more I worked in the surgical rotations, the more I got attracted to it. However, I knew that it's not going to be an easy pathway. I had never been outside of Pakistan before. So I was like, maybe I should have an open mind, see both sides, medicine and surgery. And I also went into medicine rotations, those long rounds, with an open mind, like maybe I like it, but I did not like it. So that's how I knew that I really wanted to do surgery in the end.
Thank you, Dr. Sohail. Talking about life as a surgical resident, my question is, how is the day-to-day life like as a surgical resident, and how do you balance work life with personal and social life? In addition, if you could also touch upon the number of leaves you can take per year. Dr. Yasser, if you would start.
Thank you, Ronika. So this is actually a very interesting question, because I think the seasons that we have these days, a lot of medical seasons, they have put a lot of light on the life of surgical residents, have Grey's Anatomy, Scrubs, or anything like that. And to some extent that is true, and to some extent that also gives a false account of especially when we talk about life as a junior surgical resident. It's not all fancy and very nice, it's actually not nice at all, especially when you enter the surgical ward the first day. You might be expecting that somebody would come up, hold your hand and tell you, oh, come on, let me tell you how to stitch up something or something like that. It's never that case. They would expect you to be, 2 steps ahead of everything that they are already asking you to do. And it's always the case. So the first few months are always hard, at least in my experience or the colleagues that I've worked with. I went directly to hospital for my general surgery residency. That was actually a cancer setup, and around 95% surgeries over there are laparoscopic. So it's pretty hard over there because the cases are long, they are very complicated, and there are no simple cases like appendectomies or hernia surgeries or stuff like that. Actually, they're all APRs and laparoscopic hemicolectomies and stuff like that. So it gets even more difficult to all of a sudden adjust, because you have to study. At the same time, you are expected to learn new stuff. You're expected to present in rounds. You're expected to present in the academic meetings at the same time. It's not easy, at least for the first 6 months. And then as you get more into it, at the end of first year or the second year, it gets a little into your day-to-day routine. I remember back from our final year surgery rotation, Dr. Inam Pal once taking a session, taught us something. It was a very famous sentence that he used to say, that surgery is a lifestyle. So be very sure before you want to come into it. And that kind of, stuck into my mind. And I still remember this. And even if somebody comes to me, आज भी जितने भी लोग यहाँ पे हैं जो देख रहे हैं surgery के लिए, बड़ा clearly है भाई, there is no work-life balance that you can say कि ideal हो जाएगा या perfect हो जाएगा. उसके लिए आप ये सोचना बंद कर दें. थोड़ा सा तैयार रहें, चीज़ें ऐसी रहेंगी जो अप एंड डाउन रहेंगी। स्टार्ट में आपको कई दफ़ा ऐसे लगेगा कि किसने मुझे कहा था मैं उसे गोली मार दूं, जिसने मुझे कहा था कि भाई सर्जरी चूज कर लो, अपने आप को यू वुड स्टार्ट हेटिंग एट टाइम्स। बट देन देयर आर डेज जब आपको वो सारी चीज़ें आपकी रूटीन का हिस्सा बन जाती हैं और वो सारी चीज़ें जो है आपको ईजी लगना शुरू हो जाती हैं। आप यू स्टार्ट लर्निंग थिंग्स, you start to think about the original reasons why you came into it because of your passion, so it becomes kind of easier. This was about it from my side.
Dr. Sohail, if you could add something.
For the work-life balance, there is no balance. So as Yasir said, I worked with Dr. Inampal, and I'm like, Dr. Inampal, I want to do surgery. He's like, that's a bad idea. And I'm like, but that will be my bad idea because I chose it. And he's right that, you go in thinking, oh, it's just residency, and afterwards you'll have a nice life. You will never have a nice life. Even as an attending, you will be very, very busy. So my typical day looks like, it's for usually in the residence in US, the sign out time is like 6 a.m. to 6 p.m. And we start rounding at 6 a.m. So you have to be there earlier to know the patients, new admits, overnight, look at scans. So you have to be way earlier than just 6 o'clock. You can't just show up at 6. Then you round, you go to your ORs, or if you're a junior resident, you never see the OR. You're just managing the floor patients and getting yelled at. And then when you sign out at 6, something comes up. So it's not really 6, you go home. So it's a long, long day. It's not just 12 hours, it's more than that, practically speaking. But if you love it, you'll like it. If you don't love it, you'll hate it. So you have to go in prepared. And in terms of, like we were talking about leaves, I don't know in AKU, but we only have 4 weeks a year off. No more, no less. It's a rule. And if you get more, you might get delayed graduation or something, but it's like 4 weeks off. And so maintaining a work-life balance is important in the sense, when you come home, what do? Do you, do you study? You have to study, and you have like barely a few hours left before you have to sleep again. So it's very important to figure out how to manage your day as a surgical resident. And once you get that, I think it will be much easier. I don't know if that answers the question, but it's definitely a lifestyle, and you're not going to think like, oh, it's 1 year, I'm an intern, it will end. It will never end. It will never end. Yeah, that's all I have to say.
Thank you, Dr. Sohail. It definitely seems like an interesting lifestyle. Over to you, Dr. Bashir. Dr. Ahmed Bashir.
Sorry, Ronika, I didn't catch that. So, all right. Yasir mentioned that famous line from Dr. Inampal, and we all went through it. Like we're living in the day and age of busting myths, right? And let me tell you all, and I'm willing to take anyone on debate, and I say this: it is not as bad as they make it sound. All right. It is literally not as bad as they make it sound. You are putting in more hours, yes. You're not finding time to do a lot of things, yes. But as long as that's what you want, you don't feel like you're missing out on anything, right? The thing about surgical training is that it is largely dependent on where you're pursuing it, right? As far as the first part of the question about the day-to-day and the hours are concerned. So at AKU, I would completely agree with Yasir. It gets easier as you become a senior, more because of the changing job description, as well as obviously you become of the habit of waking every morning at 6 in the morning and being at work like as soon as possible, and then having weeks that are at least 100 hours a week. All right, they're not regulated as much as they should be, but we do hours up to 100 hours a week, right? Do they get to us at times? Yes, but it is definitely not as bad as everyone makes it sound. Um, as far as balance is concerned, the way I've always seen it. I mean, when you talk about the balance, it has to be between two different things that you're doing at the same time. When these are contradictory statements to say surgery is a way of life, and then trying to find a balance with other things in life, because just make it your life in the first place, and you will very soon, in 6 months to 1 year, learn to incorporate whatever it is you want to do. I mean, I don't know if a lot of people are familiar with how I spend my off time, but you will literally see me everywhere at AKU, right? At every event, be it friends, gathering, socializing. I mean, do I work less? I would like to think not. Do I put in less work? I would like to think not. But I mean, this question about balance and these myths about balance has to be scraped off entirely for you to find peace in your surgical training. And like everybody said, as long as you want it, I'm pretty sure you're gonna be very very happy even if you put in these long hours and long days. It's all worth it. And it's definitely not like 6 hour rounds that we do in medicine.
Bashir, over to you, Mr. Ahmad Khan.
Thanks, Ronika. Actually, I think my sentiments echo what Ahmed just said. In England, things used to be similar to what they were in the rest of the world, maybe America and the rest of Europe, where it was a grueling schedule, 80, 90, even 100-hour weeks. Then there was something called the European Working Time Directive, which happened over a decade now, actually, going back to 2008 is when they first started implementing it. And what they made sure was that residents or trainees in the UK don't get burnt out. So they made a limit to how much you can work in a week. So it's 48 hours a week. And they employed more staff, more people, so that the work wouldn't be as strenuous as before, and people could get more of a life-work balance. Don't get me wrong; it's still difficult. You still have long days in the operation theatre, and you have long on calls. But overall, things balance out quite nicely because legally you can't work more than 48 hours in a week. Now, some weeks you will work 90 or 100 hours, but then you'll get days off the week after to balance things out. So on average in a month, it should only be 48 hours in a week. So that's actually a positive in the UK. So I've never actually really felt very pressured or burnt out, training over here. I think the UK training system is very well structured. It's longer, for sure. So you have to do foundation year 1 and 2. So your intern year is actually split into 2 years rather than 1, and you actually do a bit of everything. So you really make an informed decision before joining any career path. So you do, 4 months of general surgery, 4 months of urology, 4 months of emergency department, some general practice, psychiatry. You can choose, obviously, your rotations, but you do a bit of everything, a nice mix of medicine and surgery. And then I think you mature a lot more as well that way, because in those 2 years, you learn all the basic skills, how to review patients, basic suturing, basic surgical skills, basic medical skills, managing ward patients, so that when you actually go into your specialty of choice, you're not really thrown into the deep end as much. You've had 2 years of experience of how to manage patients on a ward and basic skills. So for me, the experience was never too arduous, strenuous, and I think I've always had a good life-work balance with, getting lots of time off. You get at least 28 days of annual leave in the UK. I think that was one of the questions as well. And once you've been working for the NHS 5 years, then it goes up to 32 days a year, which is actually quite a lot. And they're very supportive of study leave as well. If you want to go on conferences, you get funding for that. And so it's actually quite good. Obviously, the caveat is to get into surgery in the UK, like everywhere else, is very difficult. It used to be near impossible because they have a system where UK nationals get preference. So I was privileged because I was born and brought up in the UK. So for me, I was always, it was much easier. But for people, so if you're not a UK national, then the second tier was European nationals. So any jobs that were left over in the first round of matching, as it were, that the UK nationals, when they were left over, then it would be EU. Then finally, it would be people from abroad, Pakistan and the rest of Asia, Africa, etc. Now, things have changed, obviously, because of Brexit. And from next year, the EU nationals won't be in the second tier. Then it will be UK nationals, and then wherever is left over, then is an equal opportunity to people from abroad. So I think that's a positive for people from AKU and from Pakistan in general. They should definitely consider applying. You may not get your first choice program, you know, where you want, because it's national selection. You apply nationally, and then according to your CV, and they have like an entry test type thing called situational judgment test. I don't want to get into the details of that because, as I've said, that's a separate thing. But you know, there's a fair way that they rank you, and then accordingly you get matched to whichever program you want, whichever area you, whether it's London, Manchester, you know, up north, Wales, wherever in the UK. So you may not get your first choice because of the slight disadvantage that you're at, because you know you're a foreign national. But there will be opportunities. And another way that a lot of people do is they start off by doing their foundation year, and then they do F1, F2, and then after that, once you're in the system, some of them may even start off with general practice while they're, you know, so you start off in GP until you match in the, you know, surgical residency program that you want. And it does work out for people. Obviously, it's a bit more complicated and it takes a bit longer, but it's definitely an option worth considering.
Right. Thank you, Mr. Khan. That was a very informative answer and gave us a bit of an idea of just how life is like in the UK. For our next question, it kind of links with the previous one. Some studies, so I looked up a bunch of studies on Medscape, show that surgeons have a very high burnout rate, around 40%, and up to 30% can face depression. So can you talk a bit about physician burnout and mental health, and how does your program or system in the UK, in the US or Pakistan help to combat this? And another like sort of link to this is that most surgical residency programs have a high attrition rate. What are your thoughts on this statement? Dr. Yasir, can you start?
Well, thank you, Musab, for bringing that up. That's actually a very, very important question. And if you look at some of the studies, the program that I am in, urology, it's actually one of the programs with highest burnout rates, surprisingly. And as far as AKU is concerned, as Ahmed mentioned earlier, because it's a subspecialty program, it gets better as compared to general surgery residency. But still there are days or there are rotations. So we have basically a 6 monthly rotation with every surgeon. So it depends on the schedule of the surgeon. If the surgeon is really busy, like Ahmed is with one of the busiest surgeons these days. So you can have a burnout. But then there are ways to manage that. Programs are supportive, especially I would say the programs at AKU have been very supportive in the recent times. PGME has certain policies in place, especially, you know, if you feel like, you know, you have some issues with a particular surgeon, a particular colleague, you know, you can talk to them about it. Or if you have issues with your, you know, working hours, you can talk about it. On paper, the working hours are actually around 80 hours. It does get to 10, a little, you know, more than that at times, as Ahmed also mentioned earlier. But then it's actually, you know, very nice to see that in the recent years, PGME has been talking about it, and now things are getting better at AKU. While we're at it, you know, in Pakistan, I know a lot of people from AKU who actually chose to do surgical residencies from institutes other than AKU. And trust me, things are actually much better as far as, you know, working hours, etc. are concerned. Just to give an overview, in the government setups in Pakistan, usually a normal working day is between, you know, 7 to 12 or maximum 1 or 2 o'clock. Me and Ahmed, we have both worked in government setups during our intern years, and it's not that hard actually, you know, but then of course the training is also compromised because of that. I also worked in Shaukat Khanam, so I can touch upon that too. Shaukat Khanam is more or less similar to AKU as far as the working hours are concerned, but a good thing for those who are planning to stay back in Pakistan is that Shaukat Khanam actually pays very well, much better than any other institute in Pakistan. They have a policy that every hour that you spend beyond 5 p.m. in the evening will pay you extra amount. So the hospital, the surgeons, everyone, whoever wants to keep you beyond 5 p.m., they have to be kind of very cautious about it, that, you know, you are not just keeping them for free. It's actually a nice way to, you know, manage the working hours as well. Also, if you come on weekends or if you come at any extra point, that also pays you extra. About the burnout over there, in the government setups, it's kind of an unheard of thing. But in those private setups in Pakistan where the working hours are late, it is there. And PGME policies lately have been getting better at solving these issues.
All right. Dr. Ahmed, do you want to add anything to what Dr. Yasser said?
So yeah, Yasser has covered most of the aspects, and I pretty much agree with all that he has said about AKU and the government setups. I mean, talking about how those setups are structured is beyond the scope or the objectives of this session. So we won't go into details of that. I would strictly base it on AKU's experience. Now, if I was to talk about my personal experience, the worst week that I had was 115 hours. Um, and like and it's on paper that you will be working 80 hours a week. The problem with burnout and having mental health issues during a surgery residency, they're mostly linked to the fact that um, because of the working hours that you put, you do miss out on little things, such as your best friend's wedding, or some commitment that may otherwise have made you feel slightly better somewhat. But the other thing that every surgical team everywhere in the world, whatever setup it is, you will always find values of somewhat of a family very strongly embedded in a surgical team. And the concept of covering up for each other really exists. So you're not going to be missing out on anything big. Now, I mean, now talking about mental health and burnout can get very, very opinionated. I've personally had a very strong personal and social support system around this place. 2020 is actually the 11th year I'm spending at AKU now. I came here in 2009. This place is like home to me. So I'm probably not the best judge to answer this question. I would probably hand over it to Sarosh and Mathai if they want to add something. But for me personally, it's been pretty joyful. I mean, it's all about what you attach your day-to-day happiness to. Basically, that's what I think.
Yeah. Right. Dr. Sarosh, would you like to give a US perspective to this and how it's like over there?
Yes, so I'm going to tell you my personal experience. So usually the programs in the US are considered, the surgical programs, malignant with, they cross the work hour limit, and it's just the way it is. And having been a prelim and working in different situations, I actually went through it myself. You definitely break the 80-hour work rule very frequently. But it depends on how your mindset is. For example, if I wanted to learn more about surgeries, I would stay back. I don't mind those 80-hour work weeks, right? And I enjoy those surgeries. I get to learn more. I get to do more. But if you're burned out, you just don't enjoy anything. You don't even realize you're burned out, and you will feel like you don't want to get up in the morning. You will feel like you don't want to go into surgery anymore, and you just want to hide. And when I was a prelim, I actually went through that myself, and my family actually got really worried because here I am worried about my next year. Here I'm worried about how am I going to complete these tasks. Here I'm about my chief screaming at me, what if I don't get this done right? And I'm not even going to the OR as a prelim. So I had a lot of stressors, and I was working 80 plus hours. And this is correct that it's a very high burnout rate. Also correct is the fact that a lot of physicians leave in the middle because it gets too much, and especially if you have a family life or you just can't cope with it. Like my program, when I initially joined Mount Sinai, two of the residents I knew left the next year, and that's because they said that they just don't want to continue with this, and it's not going to end after residency. But how you cope with this is very important. I had a good support system. Although I was living away from my family, I think that's one key risk factor. I was alone. My husband is a resident in Chicago, so we were doing long distance, we still are. And I would talk to him daily, and that's how I would cope. I would talk to my family, FaceTime with my family daily, and that's how I would get it off my chest, and that's how I started to cope with it. How the system over here helps residents, Honestly, it depends on programs. Some programs really don't work on that, and it ends up being a very bad surgical malignant program. Some have actually made sure that the residents are followed up with their work hours and they give them some days off next week to balance it out. And some even have like therapists only for the residents on the side, so that if they want to get it off their chest, they can, because in America, as you know, there's so many international medical students, not just from Pakistan. They're living alone, their families are far away, they can't fly out to see them given current visa situation. So it's really, really hard. I am lucky that my siblings and my husband moved here, but some are not as lucky, and some don't get to see their family for years. So I think it's very important to talk about it, to make sure you don't hide it, and also realize that burnout can happen to anyone. It's not something to be ashamed of. And you have to realize the signs. You won't even know you're burned out. You start feeling fatigued way more often. You'll start feeling, I don't want to go to work today. They're just little signs that come up. And it has happened, at least in my program, to every single resident at some point. It's just how the US system is. Unfortunately, it's worse in some of the other practices in other countries, like for example, the UK. So it's just a lot more worse for residents here, but you have to figure out how to cope with it. So it took me some time to realize I was getting burned out, and it took me some time to figure out and talk to my family about how to get over it. But I think I'm there. I actually enjoy, I don't mind. If you're happy, you don't mind staying late. But if you're unhappy, you want to leave at like 4 p.m. So I stay late now doing cases and all that. I don't mind that because I'm in a better frame of mind. The important thing is, like Ahmed said, to make sure you have a social support system, even if you're living alone. Talk to your friends, talk to your family, FaceTime with them, Zoom with them, but make sure you have time for family. It's not just about your residency.
All right. Thank you, Dr. Sahil. Mr. Khan, do you want to add anything from the UK's perspective?
Yeah, definitely. So I think a lot of the sentiments I have echo what my colleagues have said. Now, when it comes to burnout, I think it's a bit better in the UK because of all the things I mentioned before, the European Working Time Directive, and obviously you have psychological well-being support on site with therapists, etc., all those things. So it's not as, it does happen, don't get me wrong, but I think it's not too bad. And as I think Yasser and Ahmed said before as well, that if you choose surgery, you've also got to realize that it will be tough, and you have to have thick skin, unfortunately. So it sort of comes with the territory. One thing I will say about the attrition rate and some programs being malignant, unfortunately, it is true. I think personally, I've experienced it as well. Neurosurgery seems to be, quite a demanding specialty. It sort of attracts, so most of the consultants or attendings, as you call them, are perfectionists and demand perfection from the residents as well. So, which would mean that you need to know all your patients inside out. In theatre, you need to be perfect with everything. Your fine motor skills with your microsurgical skills, etc. So they do expect a lot, and it means that you have to practice a lot in your own time. You need to read up a lot on your own time. So the expectations are quite high, and if you don't have thick skin, I can see people being quite affected by that and feeling that they're under a lot of pressure. And I've seen people with struggle from the pressure, and eventually they get through it because of the support system. You have friends and you have colleagues at work who are supportive and things, but it is difficult. And I think when you do go into any surgical specialty, you do need to realize that it is quite demanding, and you have to have thick skin. You'll get criticized a lot. I've worked in medicine. In medicine, it's not to be disparaging or anything, but the expectations are a lot less. Fine, you need to know your patients and things, but the consultants seem to be a lot nicer. And I think it's just because they're in a less stressful environment. When you're in neurosurgery or any surgery, you've literally got patients' lives in your hands. Things go wrong, they get complications, and it's just a stressful environment. And then that unfortunately gets fed down to the juniors on the wards, the junior residents, interns, etc. So it is a stressful environment. So when I've worked in medicine, I've found it was so much nicer. People are so much nicer. You get really good feedback all the time, and it's great. Whereas in surgery, you don't get that much constructive feedback, and mostly it's negative feedback that you get. It is constructive because you learn, I can say personally, you know, when I started out from now over the past 6 years, you know, it's all because of that feedback that I've learned. But at the time, it's hard getting all that harsh criticism. It makes you feel small and it makes you feel vulnerable and upset. But as I say, you have to have thick skin, and it gets better with time, and you learn. And overall, if you have a good support system, you know, it's definitely manageable and doable.
Thank you, Mr. Khan. As you all said, having the right support system is important. Moving on, the next question is more about personal life. So what are the challenges a newly married couple, a surgical trainee, often faces while working in your respective country, and how difficult is it to start a family and maintain relationships? And if you could also talk about maternity leave and having a child during residency. Dr. Ahmed, if you could start.
All right, this is probably my favorite question. I mean, it's obviously very tricky, and to be very honest, there is only as much as you can do. All right, and you know how well you fare in this department of your life, more than you, it actually really depends on your partner as well. So I mean, for those of you who are already in relationships, and I mean, like, good luck to you all, I guess. But what I mean to say on a serious note is that it really depends. You have to have a very understanding relationship with your spouse, with your partner. Um, I mean, it gets really hard, and you know, if there's any aspect of this training that actually gets to me at times, and quite literally, this is the only aspect of it. It's not having enough time with my daughter, and you know, like, I love COVID for what it has done to our work timings. I mean, don't take it wrong, but I've had a lot of time lately, and it kind of also made me realize what what all this that I miss out on when I'm actually at work. So, like I said in one of the previous questions, there are things on a daily basis, little things that would otherwise mean a lot that you do miss out on. But you know, like, everything about surgery. If I was to sum it up, whether it be work or whether it be personal life, you always have to have this dogma in your mind about quality over quantity. Um, you know, and you know, whenever there's a will, there's always a way. I mean, you could be going out home after like 40 hours. You might only spend half an hour with your family before you just fall dead asleep. But you know, it's completely up to you if you just stop by a Dalmia and buy a flower or two for your wife or your daughter, or you know, like you know, it's literally all in your hands. And it will get hard. You definitely won't have enough time. In cases of the US, just like what Sarosh is doing, it may be long distance, but you just have to keep reminding yourself it is temporary, and no matter what anyone tells you, it gets better with time. It gets better with time, and you just have to hang in there. And I'm pretty sure it's gonna get better in time. Just make sure you have to be true to your own self. You have to be true to your loved ones, those who matter, and you will get through. You will get.
Thank you, Mr. Ahmad Khan. If you could add.
Thanks. Yeah, I think as Ahmed said, it's when it comes to you know, having a spouse, or you know, a newly married couple as a surgical trainee. It really depends. I think if, as Ahmed said, you have a sort of really good understanding, and you know, your spouse or partner understands that, you know, the surgical specialty will be demanding and they're supportive, it's great. I married my good friend and class fellow from AQ as well, who's also chief resident. She's in medicine, she's doing rheumatology, and we actually had a great time, and she was very understanding, because neurosurgery is very competitive. Unfortunately, we had the competition ratio is something ridiculous, like 30-1 for each job. And that's for, you know, sort of UK national. So it's very competitive, because there's hardly any, there's very few training centres, because the UK is obviously a small island. It's only 75-80 million people. So there's not that many training centers, so it's very competitive. So she's always been very supportive and said, wherever you get a job, you know, for your foundation year, for your residency, for fellowship, you know, she'll always accompany me and come with me, because for her it's a lot more flexible. So I think you need that understanding with your spouse or partner, and they need to be supportive. Regarding starting a family and maintaining relationships, again, I think it really depends on the individual you're with. It's definitely doable. All of us have done it, and I think if you find the right person, it's definitely manageable and, you know, a great fun experience. About maternity leave and having a child during residency, so mat leave is great in the UK, probably one of the best actually. You get 1 year off mat leave paid. So I don't think you can compare that with anywhere in the world. So off that 1 year, 6 months is full pay, 3 months is half pay, and the last 3 months are quarter pay. But, you know, it's still amazing. And they're very fair. So if I, as a father, want to take half of that, you can have shared leave. So paternity leave is separate. I get a month after the birth of my child off, separate to my wife's, you know, a year. But you can also share it. So you can have 6 months each. They're very flexible. You know, some fathers want to stay at home and spend more time, and, you know, and vice versa. So there's no reason why there has to be maternity leave only for 1 year. You can actually even have a whole year of paternity leave, but it's shared. So only one parent, you know, who's working for the NHS can stay. Not both of them can have 1 year each. Otherwise, obviously, that would be taking it a bit too much. But yeah, so it's very good.
We have Dr. Anam here. So Dr. Anam Awais is from Australia. She is a graduate of the AQ class of 2010. She did her internship in her hometown in Lahore before moving to Australia after she got married. She initially worked as a clinical research scientist at the University of Adelaide, affiliated with the Department of Surgery at Queen Elizabeth Hospital and Pediatric Orthopedics at Women's and Children's Hospital Adelaide in 2013, while attaining her Australian Medical Council graduation. After which she completed her core training as General Resident Medical Officer for requirements in 2014, after which she trained as a Surgical Resident Medical Officer at the Centre Adelaide Health Network till 2018, after which she got selected as a Australian Orthopaedic Association sponsored service registrar position in 2019. She is currently on maternity leave after her second baby and soon going back to work as an orthopedic service registrar at the Royal Adelaide Hospital. So Dr. Anam, you joined at the right time. We're talking about the personal life, and if you could talk about how difficult it is to start family and maintain relationships as a surgical resident. You'll have to unmute yourself.
Yeah, sorry. Hi, everyone. I'm Anam, and I think I've joined at a very good time, appropriate for what you guys are talking about. And I've had 2 babies so far, 9 years down from graduation. And essentially, that's one of the reasons why my path has been a bit convoluted in terms of trying to get where I am now. Certainly came to Australia after I got married, did a year as a clinical research scientist whilst I was doing the exams here. I think it was difficult in some senses to start here to understand the system because we didn't have a lot of support in the sense that, you know, there weren't any previous graduates who could help you out or anything like that. So it was kind of like diving at the deep end and trying to, you know, reach a shore that you didn't even know existed. After doing my first year and finishing up my exams, did a year of accreditation that you have to do. So you do that usually as a general resident, and they make you go through pretty much the whole internship all over again. So you do 3 months medicine, 3 months training, 3 months ED, and the rest of the 3 months can be anything else. After which you can start to choose your specific fields. You invariably do a surgical resident year before you become a registrar minimum at this point in time, for the local graduates as well. And I got the tail end of Ahmad's discussion. Again, here all the surgical fields are very competitive. You've got 30, 40 people applying for the same post. And even though geographically Australia looks pretty big, but population-wise, it's pretty small. In terms of work-life balance, I think that's one thing that I learned in my last 5 years, and I can't emphasize that enough, is something that you just have to strike. It depends whether you're lucky in terms of having a spouse who supports you or doesn't. But at the end of the day, no matter who's with you or who isn't, it's attaining a certain balance, which would help. I've so far taken 3 lots of 6 months off, 2 for my 2 kids, and once because my husband, he was also a general surgical, now a consultant. He was meant to go to England for a year, so I took 6 months off to be with him. So in terms of trying to manage what you want to do with the rest of your life, it's something which is pretty doable. But I think you just have to keep at it. At the end of the day, any surgical field, anyone who has ever chosen it, you just have to, keep very clear with your goals, and some days you're going to achieve, more than what you expected. There are going to be days you achieve nothing, but then at the end of the day, as long as you just keep moving forwards, you'll find what you wanted. The last 2 years have been really rewarding in the sense that I've done what I always wanted in my life, and I enjoyed it. I grew up with everyone sort of saying, "Oh, you're a girl, you can't get into orthopedics," and this and the other. I don't think that's something that should stop you. If you think you like something or you have a passion for, you'll always make it towards the end. Certainly, maternity leave is something which is quite negotiable here. I was quite supported during my second pregnancy, during which I was a surgical, an orthopedic registrar, that they got me off the on-call roster after 28 weeks of pregnancy. I was doing, pretty much elective work and clinics, all the best things that any surgical resident would ever want, to be very honest. And then I have 6 months off before I go back. Luckily, COVID happened in those 6 months, so I'm actually going to get those 6 months back, even though I was on maternity leave, which was a bit lucky. And I'm really looking forward to going back. Yes, it's very hard. Anyone who goes back after maternity leave, it's just trying to find your feet all over again. With a surgical field, it's trying to find your hands again as well, because it's a very hands-on experience. So my plan is that a month before I start, I'll go back and sort of do a bit of private assisting before I get into, the rest of my actual job, which starts in the middle of August. I'm open to any questions if anyone has, or.
Thank you, Dr. Anu. Over to you, Dr. Yasser.
All right, thank you. So since you guys gave a list of questions already, so I actually asked my wife about this question. I was like, they're asking how difficult is it to start a married life, because I think you're the right person to ask this question from. And
so all my postgraduate years have been when I was married. It was tough. It was very tough. I'll be very honest. But at the end of the day, it is, like I said, it's work-life balance. You give some, you take some. Some people are very lucky. You find a great spouse or someone who just doesn't want to do anything. So you're like, great, I can be like, I'll go work and, you can chill out. But we're a house of 2 surgeons, so that wasn't the case. And my husband was going to get priority over me coming from a brown family. So yeah, it was tough. I wouldn't lie. I had to, first I had to go, I went to a country which I had no idea where to start from in terms of, trying to secure myself from a postgraduate point of view. And then, he was already on his path and got onto the training programs a year after. So he took precedence over what I wanted to do. But I don't think slow or steady, at the end of the day, slow and steady wins the race kind of thing. So I feel that I've got 2 kids, I'm happy, I'm doing what I love. So if you've got the patience, just keep going.
Well, thank you for adding to it, Dr. Anam. So for me, it was, since the beginning, what happened was I got married actually 5 days before my intern year started. So of course, when you are newly married, you go from home to the hospital thinking, "Oh, I'm newly married." You're getting to know a new person, and then you go home and you go to the hospital and go straight to a theater, and you would realize that the surgeon starts shouting at you, and all of that happiness all of a sudden just goes away because you're like, "What? I'm newly married and everything." But one of the challenges is that there is no particular proper off working hours. Like, you would think that I would get off at 6 today. You would tell your wife that I'll be coming back at 6, and before you know, it's already 8 p.m. And then you got to do some explaining over there, So over time, in a few months, I learned that, whatever off time they give me, I usually tell 1.5 hours ahead of that to my wife to be on the safe side. Because if you come back early, it's always like, I'm back early. And as Ahmed mentioned, I and Ahmed actually live in the similar vicinity. So it never hurts to get a few flowers on the way back home. And, you need to understand that your partner is the one, you are actually busy all day long. Your partner is the one waiting for you all day long. But I think with good planning and organization, that actually surgical residency does teach you. अगर आप अपने आप को ऑर्गेनाइज कर लें कि जो थोड़ा सा टाइम मिल रहा है उस टाइम के अंदर ही आपने सब कुछ अपना मैनेज करना है, घर के काम भी करने हैं, टाइम भी देना है बेगम को, आई हैव अ 4-year-old daughter, उसको भी टाइम देना है एंड एवरीथिंग. तो इट्स मैनेजेबल, इट्स डूएबल, स्पेशली इफ यू हैव अ गुड पार्टनर. तो हो जाता है. करनी जरूर चाहिए शादी. ये ना हो कि आप बुढ़े हो जाएं, सर्जन बनने का भाई कोई टाइम नहीं है, तो इंतजार नहीं करना, कर लेना जल्दी शादी.
Thank you, Dr. Yasir. Over to you, Dr. Suhail.
So what Yasir said is actually true. My program director last year told me that please don't have for your training to be over to have a kid. He said that because he says in surgical training, something will come up, a fellowship, a new attending job, looking for a private practice. You cannot wait for these things to settle down before having a family. I don't have a family yet, but he was right. You can't wait to settle down in a surgical residency before starting a family because you are always on the move. You're always going into new things. So, when the time is right, when it feels right, you can have a family. For me, it's a little different because me and my husband do long distance. And as a surgical resident, I barely get time, but we make it a point to FaceTime every single day. If you don't, that's a problem. In terms of talking about maternity leave in the US really needs to work on it because the residents have no maternity leave. If you are expecting a kid, you will get 4 weeks off, but that's 4 weeks off your vacation. So for example, you're expecting to have a baby in August. You will take 4 weeks off after that, and for the rest of the year, you're working. There is no additional time, no more paid leaves. There's no concept of maternity leave in the US, which I think really, really is not conducive to a good mental health for anyone who has a family. But if you want more, you can apply for a FMLA or a family leave, but then that gets out of your training and you have to delay your graduation. So it's really bad in the United States, but it doesn't mean that it's impossible. So many surgical residents have had kids during their residency and they manage to make it work. It's really hard, but again, as everybody else said, having a very supportive partner helps. I am doing long distance because of me, because I wanted to go into a surgical residency and I couldn't find anything near Chicago. So he's like, it's okay, that's your passion, you need to follow it. And he's been very supportive. Although like in brown families, typically it's not considered okay for a female to work and stay away from the husband, but it all depends on how your partner is, and that will make things much, much easier for you. There are definitely challenges. I got married in my intern year, right before he moved to Chicago and I moved to New York. And I've been doing long distance since I got married, but it's not been difficult. It's never had an issue between us because we knew what we were getting ourselves into. And as a surgical trainee, you will have to realize you'll be you'll be at work for longer hours away from your family, but as long as you know the truth, as long as you go in knowing that, it will be fine. You don't have help in the US like you do in Pakistan. You'll have your family, the grandparents will be helping to take care of the kids or yourself. But in the US, you'll have to hire nannies. That's like half your paycheck. But you know, it's not impossible. I've known so many AQ grads who are both working and have like 2 kids during residency. So it all depends who your partner is. And taking out the time to make sure that it's not about all surgery, it's about family as well is very important. Go back, talk to family, stop thinking about your residency, and spend some time before recharging and going back to work.
Right. Thank you, Dr. Sohail. Before we move on, Mr. Malkhan will be leaving us. So before he leaves, I want to ask him if you have, Mr. Khan, if you have any last minute advice or thoughts that you want to share with the audience.
I think we've spoken about a few things already, but essentially if you're committed to surgery, you really need to make the commitment. You need to build up your CV accordingly. You know all of these things anyway, I'm sure. It's, you know, very competitive, so you need to get into research, you need to improve your knowledge, clinical skills, and really stick with it. Like Anam said, you know, just because you're brown or you're a woman or, you know, you're in a foreign country, it doesn't matter. At the end of the day, if you are passionate about something, you'll get it. I haven't met a single person who was dedicated to surgery and hasn't got the, you know, job that they've wanted in the end. Some people quit along the way, but then they quit. So you can't use them as, you know, your barometer. Essentially, the people who really are committed to the specialty and the lifestyle, you will always succeed in the end. You've got to put in a lot of hard work and, you know, give it time and eventually it'll happen. So if anyone has any specific questions about training in the UK or anything really, they can always email me. I'm happy for you, Musab, to share my email address with the audience. So if there's any questions or whether it's neurosurgery or even foundation program or anything really, or how to get into general surgery, I'm happy to help advise wherever I can in the future.
Right. Thank you, Mr. Khan, for attending the talk and for your presence here today.
Thanks. And I just, it's good to see Anam as well. I'll speak to her hopefully a bit later at some point. And Salma says hi as well, by the way. Thanks. Take care. Bye-bye.
Bye. Right. So moving on to our next question. So this is to do with finances. So the question is the average salary of a resident in your country enough to lead a comfortable life, have savings, even support a family? And if you're sending some money back home in Pakistan, so this is for Dr. Sorsh and Dr. Anam. And adding on to this question, can you talk a bit more about moonlighting opportunities, working locum or working private to, like, you know, support your income, and if that's needed or not? So if Dr. Bashir could start this off.
All right. So, I mean, this is something that should be on everyone's minds when you are choosing a field, because you know, like I committed myself to a field very early on in my med school life, and the issue was I knew for a fact, and this was a very well informed decision that I made when I decided on pursuing it at AKU. I spoke to a lot of people in the US, and then based on that, I decided to do my electives in the UK. And I actually came across Dr. Ahmad Khan. He really just left us, but while I was there, we had a little chat in Subway too. But what I mean to say is, I stayed at AKU to pursue urology because I already had made my mind about it. And the way I saw it back then, there was no other structured training program that I would be able to do urology in, unless obviously I was willing to sacrifice a lot more things, primarily the number of years that I was willing to spend becoming a urologist. Now, in order to stay in Pakistan, this is something that's very important. You need to know where you stand financially, personally, as well as at the backing of your family. All right, now this is very important. I would assume people who are at AKU at the moment, and I can't speak for everybody because I know there are huge amounts of financial aids involved in the system, but anyone who is currently paying AKU's dues probably has a sound family backing. I want you all to register that as a privilege that you guys have, based on which you can actually sacrifice on a dream of going to the US or the UK or anywhere abroad and pursue what you really want to pursue. For instance, something like ophthalmology, and you don't want to spend 3-4 years of postdoc training or PhDs in neurosciences or something, right? So consider yourself privileged. That's the first thing. But obviously, there has to be some place where you draw the line. Back when I started training, and we're going to talk numbers here, right? So that you guys actually do take home some food for thought, right? When we started our training, Yasser started in Shahkhanam, I started here at AKU. I don't know about Shahkhanam pay scale, but AKU was paying 60,000 rupees a month to a resident. And I mean, it's a completely different debate, but long story cut short, I was not ashamed to still continue being financed partially by my family in order for me to maintain a certain lifestyle that I had gotten used to at my time at AKU. Now, second year onwards, luckily, Adil, third year onwards, Adil Heather, when he came back, so he brought about a huge change. Now, this salary went from 60,000 PKR directly to 125,000 PKR. All right, and this was a huge jump. This is literally twice the amount of money that we were earning. Now, 1,15,000 being the baseline, and 10,000 being from outstation because I'm primarily from Lahore, right? So essentially, to rephrase the question that has been posed, is 1,25,000 enough for you to stay and have a decent life in Pakistan with saving, and then you end up having a child or something. So I mean, in my case, my spouse was always working. All right, she did her internship. She was earning. She became a TA then on, and she was earning. And she started her MPhil now. So even though she's a student, but she's still getting a stipend, and she's looking to apply as an instructor as well, which might really jump up the finances. But most of the people I see around at AKU, you probably will end up with a spouse who will also be working. All right, so there are actually going to be two incomes. Now, I'm very close to my friends in the US, and I know really well. I mean, if there are two people living in the US, preferably together, and they're both earning, one of their salary is going to be a saving hands off completely, right? And it's up to you, whatever you want to do with the money. The same would apply to two residents who are working in Pakistan, all right? So even though numerically the amount is going to be a lot different, where you will stand in the social pyramid in terms of what you can afford, where you can live, the car you can drive, and the outings that you can have in the social pyramid is pretty much going to be comparable. All right. So we're talking about two residents living together, and then you have an income of around $250,000, 250,000 rupees, my bad, and then a month. And then if you do end up getting some pocket money or some small amount from your family to support your rent or something, for instance, I mean, it's easy for me to say, but let's just be honest. If my dad sends me 50,000 rupees a month, I mean, so my income then automatically goes up to around 300,000 rupees in Pakistan. And, like, I cannot spend that money even if I want to. Um, Obviously, there are issues with the first time investments in your living place, in your car, in these kind of things. But then thereon, I'm pretty positive you can end up saving, you can end up sending to your family even, because things are changing fast, and things are on the up. And that would apply to all the questions that we've answered so far. The burnout is going down, the working hours are getting better, the pays are going up. So all in all, the satisfaction level that we guys have is on the up. And at the end of the day, I mean, I'm going to turn 30 next month, and this is PG by 4 that's going to be ending soon. I have 2 more years of training before I become a consultant urologist, right? So and then on, I mean, and this is the time frame that you actually have to pass through. You may have some tough ends, but I can assure you guys, back then when we were starting, things were very different. Right now, if you were to establish yourself from scratch in Pakistan financially, you will get by just fine. You won't have to worry. That's all.
All right. Thank you, Dr. Ahmed. That was a very informative answer. Dr. Yasser, do you want to add on to anything that Dr. Ahmed said?
Yeah, I won't take much time because Ahmed has pretty much detailed the situation. It depends on what you call a comfortable and a nice lifestyle, because we can find residents in AKU who did not come originally from AKU, and they are pretty much satisfied with living in the in the area behind AKU. And but some of the residents won't be comfortable there, and I'm sure many of the students would have this question: where can you live as a resident in AKU? What will you drive, and what will be your lifestyle? Will it be even comparable to what you have at home right now? So I think it's doable. And as Ahmed said, that sometimes you do need support from your family, but I think in the current scenario, since the pay has been raised, I think at least for a small family with a nice house and a nice comfortable living, it's doable. As far as Shaukat Khanum is concerned, it was paying more than what AKU is paying. The pay at Shaukat Khanum depends on the number of hours that you work, as I earlier mentioned, and the number of calls that you do. So on average, it pays around 1,40,000-45,000, or sometimes it crosses 1,50,000 mark. But at AKU, it's sort of a fixed salary of around 1,25,000. But in any case, I think things have improved a lot. Just going back a few years, maybe 6 or 7 years, there was no concept of a six-figure salary of a resident in Pakistan, but it's changing very quickly. Even in government setup, it's pretty much doable. In government setup, you have less hours with good pay, and then you can add up to that pay by working a few extra hours in the evening. So overall, I think it's doable and it's not that bad. I think it's one of the important questions that I had too when I was deciding to stay in Pakistan. And I would encourage the ones who are planning to stay in Pakistan. Inshallah, it won't be too bad.
Right. Thank you, Dr. Yasser. Dr. Sosh, do you want to add anything from the US perspective?
Yes. So it's actually fortunately quite a good salary for a resident living alone or with his or her spouse. You can definitely save, you can definitely send money to your family. In my case, three of us were in AQ, so I had loans from AQ, so I was able to return them from day one, and it hasn't been an issue. You can also travel as well. So in US, I don't think it's been an issue. The salary is same for surgical and medicine residents in most of the programs. Sometimes it's a couple of $1,000s difference. But in terms of states, it varies, because if in New York, it's higher because the taxes are like crazy. But however, I have never had anyone, so many of my friends are in residency in different categories, peds, medicine, psych. I've never heard anyone complain. And even when they've had families, it's not been an issue raising a family with a resident salary. So in terms of US and residency salary, I don't think it's ever been an issue with anyone, unless you have huge loans or something else is going on. But it's quite affordable to be able to live a comfortable life here.
Right. Thank you, Dr. Sosh. Dr. OS, do you want to add anything from the Australian perspective and how it's like in Australia?
Hi. Essentially, from your start, it all depends on what PGY level you come from your country. I was PGY 2. I had done an intern year. So you get pay a little bit more than the interns pay. It is roughly around the ballpark of $2,000 a fortnight, and then every single year it just keeps going up, and every single time you get into a training program there's an increment, and then every single time you get into consultant post or things like that, there's increments. From that perspective, it's a very good number to have, and definitely you can support your family back home, or be able to support other interests alongside. You can support your own further education, for example, masters, etc., as well, alongside all of that. People who are interested in alongside doing masters can also ask for grants, and the government also helps them pay out their bills, etc., as well.
Thank you, Dr. Anna. So moving on, our next question is more about the academic environment. Do you get enough time to do research, especially the basic science research or working in a lab? And do you get to attend conferences? In addition, is there enough time to study for your board exams? I also want you to talk about the fellowship and specialization, as in how difficult it is. Do you get enough time to plan? Dr. Suhail, if you could start.
Yes, so in terms of academic environment, the trend in surgical residency, especially at my program, Montefiore, is that they have their own research lab. And if you want to go into a very demanding field, for example, surgical oncology or plastic surgery, you usually, or the residents over here usually take a year or two to go for research and then come back. That gives them a good break from the grueling hours, but also gives them a very good CV. But unfortunately, during residency, it's up to you how much you want to do it, how much time you can take out. It's very dependent on the individual. You can still do research, but not at the level to make enough numbers of publications to go into surgeon. Many have done it. It's just not preferred because it's hard. And then outlook towards fellowships and specializations is most of the residents go into fellowships. There are some who are even citizens and who want to settle in a more private or a smaller area and they just want to do general surgery practice. They go into that, but the amount of those is very less. So the trend in the US is towards subspecialization, especially in the bigger cities like New York. It definitely, in terms of research, it varies from program to program. So my program has a research lab, and so they have people who do the data for you, who helps you combine the things, and it's actually easy and helps you with the ideas as well. Some programs are smaller, some programs will not have that, but again, it's up to you how much time you want to dedicate. Sometimes you're just starting, you don't want to do anything, but some people are so dedicated that they don't want to take a year off for research and still get to do many publications, and they put in their free time into it. In terms of basic science research, if you're a resident, you won't get time. Honestly, you won't get time to do basic lab work. You'll usually be doing clinical research, but if you take a few years off, which they do, then they go into labs and then they do the basic science research. So as a resident, no, you cannot, or you don't have time to do that. And the excellent question, which I think is very important, is how do you find the time to study for exams? So one of the misconceptions I had when I went to surgery was like, oh, unlike medicine, I don't have to study. Oh, I don't have to, micromanage patients. I don't have to study, but that was 110% wrong. It matters more in surgery than in internal medicine, how much you score on your in-training exam every year and on your board exams, because your fellowship also depends on that, unfortunately. And as a prelim, they just look at your score. So initially when I came as a prelim one, I did not study well because I was just concentrating on my work and impressing the attendings and staying in the OR late. So I didn't study and I didn't realize the importance until my score came back. So what they do over here, every year you give your exam, if you're giving your exam as a PGY1, then it's compared to all the surgical PGY1s across the country and you get a percentile. So it's very, very competitive. And there's so many prelim residents that they will only look at scores in 80% or higher to actually consider an IMG getting into a percentile of 80% higher into a categorical program. So then that's when I realized that, the studying part is really important. And then I started taking out time, my free time, my weekends, during my work, if I had some time between cases to do some questions. So actually, you will not be getting like, oh, today's the day you study. No, you just have to incorporate it into your daily routine to study, which is why surgical residency is even more harder than compared to other residencies, because the score is looked at. The programs here even suspend their categorical residents, no matter if they're IMG or an American or whoever, if they're 30 percentile or less in some programs. It's not a rule across the country. So getting your good score is extremely important in surgical residency in the States, which many of the people in AQ, and myself included, did not know when I actually came here to train. So you per se as a resident do not have time, but you have to take out the time. The good thing is that they do have conferences dedicated to studying every Friday, where no surgery resident is supposed to go into the OR or do any case. So we have like 2-3 hours every week where the residents sit and discuss a particular topic, do some questions, but that essentially doesn't help as much as you studying on your own will. So long story short, it is important to get some study time in residency, but you have to take it out yourself. And then in terms of conferences, they do cover so depends. In New York, they have a union for residents. It's called CIR, Committee of Interns and Residents. They actually give you a lot of stipend for traveling, for conferences, and it will be covered. Like you pay yourself and then later it will be covered. Some other programs in other states, they have, like they allot you $500 or $700 every year, and you can use that for a conference. But yes, if you want to go to a conference, your program will encourage you to go and you won't be stopped. So that's the good thing. So academia is highly encouraged in the States. And even though you don't have time, you just have to make sure you are on top of it and do it on your own. I think that's all the things I had to say. Yeah.
Thank you, Dr. Suhail. Dr. Anam, if you could add Australia's perspective.
In terms of research, definitely you do have time throughout your course of work to be a part of as many projects as you possibly can handle together. Essentially, don't cross 100-hour work week or anything like that. So definitely something that I've kept alongside as well. And then you can go into basic science research as well, but it depends on what you're doing and who you're affiliated with and what you're aiming to get out of it as well. A lot of people who do masters alongside end up doing basic science or animal-based lab research as well. But again, it all depends on what you're aiming for, what specialty you're aiming for, and which subspecialty people you're working with in terms of time off for studying. You do get professional development leave, which is 10 working days during the year. So you can use that for any courses that you want to do or use that for exams. You have 5 weeks of annual leave on top of that. So you essentially end up having up to 6.5 weeks off, which you can use it for pretty much whatever you want. If you're doing a master's, which can be something that you're doing part-time or online, definitely something that you can work around with your hours, especially if you're doing it in the same place or the same hospital, then it's easy for you to manage both together. And in terms of private assisting, that also you can do after hours. It all depends on what subspecialty you choose or what level of work you're doing. For exams, in addition to all of that, you do get some paid allowance as well to cover your exam fees as well. So that's another incentive in addition to that. You can let me know if I've missed out on any other detail.
Thank you, Dr. Alim. Dr. Ahmed, if you could add.
I mean, there's not much to add, but I mean, you've had the US perspective of it, you've had the Australian perspective of it. As far as research here at AKU is concerned during your surgery residency, it's not as good as the US or Australia, obviously, but it will always, wherever you are, come down to one point, and that is your own personal dedication. You know, there's no such time. There's no such thing as not having enough time. You have to make time. After the first 2 years of our residency, we are subjected to what is called the intermediate module. It's a pretty tedious exam with preparatory times ranging from at least 4 to 5 months, right? And the first 2 years of training, we've we just spend whining about not having enough time to study, but then all of a sudden when we have the exam, we do find ourselves putting in those 2-3 hours a day to study. So again, it comes down to dedication. As far as research is concerned, it it really depends on how much you actually want to do. We had a neurosurgery resident graduate with 54 publications, all right? But again, so that's up to him. And then you will also have a lot of residents who will graduate with no publications at all. You need to be very clear about where you're moving from residency. For someone like me personally who wants to move directly from his residency to a fellowship in the States, I need to have some publications to my name, and in my head, hopefully, I will be able to have 6 publications to my name before I graduate now. And like this is something I personally think I do. I put in bare minimum effort to research. If you put in effort, you can achieve a lot more. If you want to go a step further, that's somewhat similar to what Sarosh had to say. And we've had residents who take a break of an entire year between their senior years of residency to enroll themselves at a research program at AKU only, and you get yourself a bachelor's degree. It can be a master's as well, and then you get a number of publications to your name as well during that year. So I mean, it will come down to what you want to do and how much you want to dedicate yourself to this purpose. But like I said, you will have time because you will learn to make time. You will learn to make time, and you will definitely learn to make time. So if Yasser wants to add anything to it, I'm pretty positive you can do it.
Yeah, I think just adding a little bit to that, it's dedication, and there is always time. I think you can find some time. I recently did my MRCS with all of this schedule, and I think it was tough in the beginning, but then of course you start to find time in between surgeries. Between 2 cases, you have half an hour. You can just spend it while sitting doing nothing, or you can, like you do at AKU rounds, you can take a pocket book with you and you can start reading up. In between you can find time for that. And as far as research, to be honest, Pakistan is not really the place, or AKU even, for research labs, or these concepts are not that much well established over here. But then if you have a good training and good background in research, or you really want to work hard with that, I think the field is open. There's not much competition in this field, and you can really do well if you are yourself enthusiastic about it.
Right. Thank you, Dr. Yasser. For our next question, it's basically, what are the prospects of settling in another country and practicing there once one has completed training in your country? So moving from Pakistan to the US to Canada, UK, Australia to like the UK or so on. If Dr. Yasser could start this.
Well, thank you. So this is again, especially considering that we are training in Pakistan, the first question we get asked at AKU from AKU students is why you, chose to stay in Pakistan. The second question, oh, now that you are in Pakistan, are you going to get a chance to settle in another country? There have been a lot of examples, and not only from US, but also from UK. And actually, there is a pathway for UK that is the CCT pathway. I won't go into the details for that. But if you do well in your research, if you clear some exams, especially for UK, the pathway is straightforward. You just have to clear a couple of exams, and then if you get GMC registered, then at least for the non-accredited fellowships, there is a good opportunity that you can get them. After spending a couple of years in those fellowships, then you can move on to doing your CCT, which is another long topic of how to go about it. But then, yes, you can settle over there as a consultant. About US, there is no other way but to do your steps, and then after that, you can do fellowships. And what I know about it, I'm not really too sure about it. But what I know is that it is a little harder over there, especially if you don't have your primary residency in US. But I know a couple of people, at least from our program, who did eventually settle in US after doing residencies over here. Another thing is that the prospects of settling are less talked about, and it's more about doing fellowships when you are training in Pakistan. Then at least getting 1 or 2 good fellowships from UK or US is always something that we look forward to. And most of our consultants who are practicing in AKU do have some kind of a small fellowship from there, and there are good opportunities for that. The one big challenge that some people face is that once you are not a primary resident in that country, in another country, then even as a fellow, the fellowship might not be as well structured. It would be non-accredited, and then you may have to work like a senior resident. You won't really get out of that resident life for another couple of years if you're not a primary resident from that country. Recently, just a bit I would add about recently in Pakistan, there has been a trend that CPSP is now introducing post-graduation fellowships in different fields. The latest one that was added was a surgical oncology fellowship, and hopefully they will add more fellowships and you won't have to really go abroad for that.
All right, thank you, Dr. Asir. Dr. Ahmed, do you want to add anything to what Dr. Asir said?
Yeah, actually, there's actually quite a lot that I want to add to this. The first thing that I want, I mean, I'm slightly going to intentionally deviate from the topic and the objectives of this entire session. But one thing that I want all of you who are here today to think about in your head and maybe try to decide is where you see yourself 15 to 20 years down the line. All right, that is the first and foremost question that you need to have in your head. Where do you see yourself 15 to 20 years down the line as a consultant? Where do you see yourself practicing? All right. Now, if I was to speak about myself, right, and especially in terms of urology, now this is something that I personally figured out on my own after having worked in the UK doing my electives and and getting a chance to meet some international urologists at some conferences. Now, the thing that we need to understand is what we are evolving into in the world at this moment is something, and I speak for urology, something that we refer to as first world urology and third world urology. All right. Now, we may be tackling the same diseases, but the prime example, the exhibit A, is the robotics. All right. Whereas in a lot of centers in the US and UK especially, robotics have taken over. Laparoscopy is widely rampant. I mean, it is a little hurtful to say the least that in AKU, we barely are doing any laparoscopic procedures when it comes to oncological surgery. Obviously, it's backed by data that the outcomes and the prognosis do not differ in terms of oncology, be it open or laparoscopic, but it is a skill set nonetheless. Now, what does that teach me? That teaches me in 15 to 20 years, question number one, I answered for myself. I want to see myself in Pakistan as a consultant. So what do I have to achieve while going to the US? Am I going there for the skill set, or am I going there for what I like to call the thappa on my nameplate? All right. So because that really sells in this part of the world, it really sells. Everybody will refer to you as surgeon America. Okay? So as far as the skill set is concerned, if I talk about prototypical training of urology in the US, that will not help me do a urological or establish a urological practice here in Pakistan. Definitely not robotics for at least the next 3 to 4 decades, right? So now, for me, this teaches me what I need more than the skill set is actually the thappa against my name, right? Because the surgical skills that I will be using in Pakistan, I'm going to learn them pretty much at AKU during my time in residency. Obviously, there is something that we want to move towards. So when I plan my fellowships in the US, and I will do that, I will be focusing on laparoscopy. So you have to think of a skill set that you can learn over a couple of years during fellowships and that you bring back, all right? Now, what are the prospects of me finding a fellowship in urology, which is a subspecialty? The prospects are absolutely brilliant and in my favor. What I need to do, however, is to have my ECFMG registration by giving my US MD step 1, step 2, CK, and whatever replaces CS now. All right, CS, I probably won't be able to because of all the work experience that I've done, right? So when I go to the US, there are programs of fellowships which are ACC accredited, and what they require is you being ECFMG certified. Those programs are 1 year long, right? So when I do a 1 year fellowship, I can then move on to another 1 year fellowship. I can then move on to another 1 year fellowship. I can then move on to another 1 year fellowship. Because I will be a fellow, I will probably be earning a lot more than I would have been doing as a urology resident or doing my postdoc right now. So now this is the thing that most people don't realize and don't know, and it's the Indians who are mostly taking this route. What the US requires for you to be a consultant in a specialty is the number of training years. It does not specify whether that training is residency training or it's post residency training. All right. So if circumstances change for me and the answer to me settling down in Pakistan changes, I will always be able to do fellowship after fellowship after fellowship after fellowship to become eligible to be a consultant in the US. Now that's an alternate route for me to get into the US. Secondly, obviously, as I said, what I intend to do, I do my fellowships and I come back. Now, I personally know 3 people who have taken this route from Pakistan. One of them was an AKU graduate. The other one is going to be graduating from one of the specialties this year from AKU who already has secured a fellowship spot. There was one person from orthopedics last year who went, and then there's another one who's actually not from AKU, but who's also secured this fellowship, right? So this is a track that can really be exploited by people who are trying to pursue specialties, people who don't want to waste time or spend extra time trying to pursue those specialties, and people who want to be US certified and then eventually come back to Pakistan. So all in all, whether or not you're planning to go to the States for your residency, do not give up on your steps. Once you start on your residency, you will not be able to get back to USMLE step 1. You will be able to give your step 2 anytime with bare minimum preparation. USMLE step 1 is something that you will just not be able to put down your head to. So the key advice here for all of you, whether or not you're planning to go to the US, is stick to your USMLE steps and make sure you get them.
Right. Thank you, Dr. Ahmed. And I guess it's good that the step 1 is going past fail now. Dr. Sarosh, do you want to add anything?
Yes, actually, I'm working currently in transplant. My rotation is transplant, and the 2 fellows I have are both international graduates. One is from Turkey, who did his residency in Turkey. He's from Turkey, and the other one is from the Middle East. I think somewhere in Saudi Arabia. But they are both examples of people coming from outside, having completed their residencies and then doing their fellowships. I think the key is, as Ahmed said, is giving steps earlier, but also applying and knowing which programs, smartly applying to programs. Not everyone is going to give you a surgical fellowship. It's competitive, but applying where, for example, big programs like New York, or applying to areas where you know the history of taking IMGs. And urology is highly competitive, but there are certain suspects. If you want to do something else, for example, like transplant has some open spots every year. It's not as competitive, so it's slightly easier to get into. Urology has lesser spots and it is competitive. Similarly, other fields like MIS, minimally invasive surgery, you have a few spots that you can apply to. So it depends what you want to do. It depends on, again, your research, your USMLE. Not, I guess scores don't matter anymore. I don't know, but it did in the past. And also research and what kind of program, like if you're coming from a well-known program like AQ, people know AQ everywhere. They're like, oh, Aga Khan, they say like Aga Khan. So they know the program. So it'll be easier. If you're coming from a program that's not well known, it might be a little harder. So there are little factors, but I think it's doable. I've seen so many people do that.
Right. Thank you, Dr. Sarosh. Dr. Ainam, do you want to add anything from an Australian perspective? I think you're still on mute, so you'll have to.
Yeah, sorry. During your training for any surgical specialties, there are opportunities that you can go outside of Australia and most people end up going to the UK if you can find a program which supports your trainings, which is accredited by the Royal Australasian College of Surgeons. So that's one thing. In terms of fellowships, most people would go abroad to either Europe, Canada, or the UK for fellowships. There are people who then settle there as well, and very few would go to America. I do know of one of my seniors who's a spinal surgeon who went to do his fellowship in the US for 2 years and then came back. Certainly, he did have opportunities that if he wanted to settle there, he could do that too. So I guess your opportunities of doing fellowships or settling in a different country other than Australia are definitely there. And I'm pretty sure if anyone who did, their surgical training here in Australia wanted to go back to Pakistan, then there are opportunities to do that too. I personally don't know of anyone who has done a surgical residency here and gone back to Pakistan, but I think that's definitely an option. The other option, which is quite interesting, is that here, if you're in your, so once you become a consultant, you can choose to have a public post. You can also choose to have a part-time public post with a part-time private post, where you choose what days you do or you don't. You can also plan leave up to 3 months from your public post and go back to Pakistan. For example, if someone wants to do, welfare work for a month or something like that in a year, that's definitely something that you can think of, which is quite possible. So it quite interests me personally as well that you're able to go back. And even if you want to do some kind of welfare work or get an organization or a private group to work with you, then that's an option as well. Thank you.
Thank you, Dr. Anu. Moving on to the next question.
Ronika, I'm sorry I'm interrupting. There are the two more things that I actually want to add. One of them, in fact, now the ACGME, which is the accreditation body in the US for graduate medical education, it actually visited AKU 2 years ago when AKU applied for accreditation of its graduate postgraduate medical training. For that being said, if that had happened, our residency would have been completely recognized by US. I mean, at least some specialties would have been completely recognized by the US. Now that failed to happen. I was in the meeting with the people who came from the council, and the primary reason why we weren't able to get that accreditation was our working hours. Now, since the return of Adil Haider in GS also as the dean, Asad Latif in anesthesia as the chair of anesthesia, Amir Sharif and Sadr Khan leading GS. So things are changing at AKU, and things are quickly changing at AKU. And I really hope, probably obviously not during my residency, but by the time that the current student body makes its way to this residency program, I really hope and foresee that this program is going to be accredited by ECGME, and once that happens, we will then see a huge paradigm shift in the number of people who eventually end up going to the US for the residency. It's going to be a huge step. So that is something that you all really need to keep your ears open for. That is something that the current student body can keep on pushing PG and me, especially Adil Heather, and give them this ray of hope for them that if they are able to pull something of this sort, a lot of people will eventually be giving back right after med school. So that's something all of you should also know, and hopefully it's only a matter of time that it happens. And the second thing that I wanted to mention, since Dr. Ahmad has left us, I told you my decisions were informed. So I looked up UK training pathway as well, especially in terms of post-graduation. And what Yasir mentioned about what your job title is going to be versus what your job description is going to be. So what essentially you are once you've completed your surgical training elsewhere, for instance in Pakistan, they refer to you as an ST, as a specialist trainee. So what that makes you, what a surgical training elsewhere makes you is an ST6 or an ST7. And the issue, as Yasir pointed out, is more applicable to the UK, where even though on paper you will be an ST6 or an ST7, you will be probably doing work that will be more suited to an ST3 or an ST4. So that's something that you guys also should keep in mind.
Thank you, Dr. Emmett, for those advices. Moving on to the next question that we have is, how does surgical residency in your country differ from others, that is UK, US, Australia, Pakistan? We don't have Dr. Ahmad Khan, so we won't be talking about UK. And within Pakistan, if you could also talk a bit about how it is different in public and private hospitals. Dr. Yasir, if you could start off.
Thank you. I think we already talked a little bit about it. We'll just briefly, discuss it again. Firstly, about Pakistan between different institutes. Well, there are three very good programs in Pakistan. When we talk about the private sector, that is AKU, then Shaukat Khanum in Lahore, and Shifa International in Islamabad. And all of them are pretty much similar as far as the working hours are concerned. In Pakistan, the training program is very much dependent on the consultants or the supervisor at any particular place. And basically you would see that people won't be referring to that I am going to train in that hospital. Instead, they would be saying, I am going to train under that particular supervisor. So you can't just say that, one place is good for every single program. AKU is generally, because of its PGME being very well structured, it's generally considered to be a nice place to train in all over Pakistan. But even with AKU, you can't say that all the programs are the best in the country, or they're very good. It's not universally true. As far as the comparison between the two places, the government and the private sector or AKU, is that the working hours, number one, as I earlier mentioned, working hours in government setup is much lesser. Getting an off is much lesser. You don't have to go through the HR. There is no concept of an HR or such a thing. Once you are a trainee in government setup, you are just a trainee for that particular ward. So if you have locally made arrangements for your, somebody covering up for you, so there is no need to go through the hassle of, if you are on leave or not. It only applies when you are going on an extended leave, maybe for a month or 2 months. For 1 day, 2 days off, you don't even need to tell the administration as such, as far as my experiences with Jinnah Hospital Lahore. And that is also what I've heard from my colleagues. About the training program, it again depends. For the surgical training, hands-on training is very important. In government setup, hands-on training again depends on how good of at terms you are with the supervisor or with the senior trainees over there. And if you are at good terms, you may get a lot of chance to do some work. At AKU, they have made they have tried to in recent years made changes where every resident is supposed to have at least some basic hands-on training, and only then they can move on to choose if they want to give them or not. So you have to choose very wisely if, especially in Pakistan, you're planning to go to a government setup. As far as other countries are concerned, as Ahmed mentioned, it needs to be an informed decision. You can talk to your seniors in UK or US, and then you can choose. Again, coming to some particular specialties, you don't need to be worried that your training would suffer a lot if you are training in Pakistan, especially if you are planning to practice all your life in Pakistan. As Ahmed mentioned earlier, if you know robotic surgery, but you don't have a single robot in Pakistan, then you can't do anything with all of that training. And while you have no hands-on training with open surgery, then you would suffer in Pakistan. So all in all, it's an informed decision of where your eventual plan to practice is. I was recently having a conversation with one of the consultants, and he mentioned the same thing, that if you or some trainee goes to UK and learns robotic prostatectomy, a similar example, what would be the use for you to come back in Pakistan and just settle in Pakistan and do simple stone surgery after learning robotic prostatectomy. Overall, of course, Pakistan's training programs lack behind not only in structure and organization, but also as far as the latest technology is concerned. But if you plan to just do your basic training and then do a couple of specializations, come back to Pakistan, I don't think it's a bad deal. For as an advice, if you're planning to stay in Pakistan, you just do not go for the hospital's name. That you say, oh, I'll just train in AKU for any particular specialty. AKU has a lot of programs, but not all of the programs are good. So you need to talk to somebody who's inside and then decide about it.
Thank you, Dr. Yasser. Dr. Ahmed, if you could add to the few benefits and drawbacks of training in Pakistan that Dr. Yasser talked about.
I mean, one thing that I will never ever go on to claim is that training here is more superior than training in the States. I will never do that. All right. We're decades behind now. That may work in your favor. That may work against you. You might bring back something like bariatric surgery, which literally only 1 to 2% of the population can afford, right? So that's just an example. I'm not really referring to any particular surgeon here at AKU, but you know, like as far as I think if I got Yasser correctly, I might have to disagree with him very slightly. From my personal experience and talking to a number of different people, let me tell you, and you know, I won't defend this here right now, but you can meet up with me and I will defend it. If you plan to stay in Pakistan for your surgical training, make it AKU and not any government hospital. All right. Not you don't go for the 8-to-1 job with 3 calls an entire month. Do not go for hands-on quantity with lack of quality. All right. So if you, long story cut short, if you do decide to stay in Pakistan, go with AKU. I say this based on a lot of interaction with a lot of people in a lot of different hospitals. As far as AKU's personal, comparing it with US would be comparing apples and oranges. If I was to, I've already told you, training in the US definitely is superior training than as compared to training in Pakistan. But you know, like, you have to be realistic about whether or not you're going to make it there, right? I think that's pretty much both the questions that you asked. One thing more. I mean, about AKU versus abroad, and for me that's synonymous to Pakistan versus abroad. For me, Pakistan means AKU, right? So Pakistan versus abroad, there can be a lot of reasons for you to choose your place of training. Training and your subspecialty of interest is only one of those reasons, right? And you know, like, and we are only strictly talking from a training perspective. Training abroad is superior, period. However, you may have to compromise on what you want to pursue on a lot of different factors, because at the end of it, it's an interplay of so many things that you don't even realize and understand at this point. And you know, like, and I hate to say this, it's unfortunate, but you know, the reason might even be being part of a religious minority targeted in this country that might make you want to leave this country. So and I know people with examples who've been through this. So there's going to be a lot of things that are going to determine where you end up choosing to train. However, as far as just training is concerned, training abroad is definitely superior.
Thank you, Dr. Ahmed. Dr. Anam, how is the training system different in Australia?
So essentially, how I would compare things from Australia versus you know, the other countries that you've mentioned, the pathway is a little bit convoluted for somebody who's coming from a different country. For example, if you're an international medical graduate and you want to start in Australia, the path is a bit difficult. Your first job is the most difficult job to fetch. And passing the exams, if you've got someone around or someone to support you to explain to you, you know, how to study and and so on and so forth, then it's slightly easier, but it's just something that we're not very familiar with, so it just takes a bit longer. Other than that, you do end up doing an extra intern year, so that wastes another year. You then end up having at least 1 or 2 surgical resident years before you get a registrar job. And that depends again on the surgical specialty. General surgery, sometimes you need it, sometimes you don't. But invariably, all other surgical specialties, you definitely do need it. Now, all of this years of hard work doesn't go to waste. I've done so much of different kinds of surgery. Like I've done a bit of general surgery, I've done a bit of plastics, I've done a bit of vascular, and now I'm doing, what I wanted to do is orthopedics. I did orthopedics as a resident as well. All of this made me better. I don't think it made me worse. The other point to note is that at the stage where I'm at, I can deal with a lot of other subspecialty work within my field, so I can do grafts and things like that by myself too. The third point is that by the time you get here, you're PGY at least 4, 5, 6, sometimes 7. So you're actually pretty senior by the time you even actually get onto the training program. At this stage, like I can independently operate most trauma, like orthopedic trauma, by myself, and quite like complex trauma or having a hemiarthroplasty, I would need someone who's done it before, but pretty much do the whole case by myself. So by the time you actually get to that point, you're a bit more senior than what I would have thought somebody back in Pakistan or somebody in America would be. Most of American training from my time that I remember when I went during my medical school days, that I did my elective at the Children's Hospital of Philadelphia, they compared their fellows with European fellows, with the British fellows and the Australian fellows. And what they said at that point in time was that the Australian fellows are way more independent with their operating, because by the time they get to the end of their training, they can pretty much be consultant and run the show rather than do a couple of years of fellowship and then become operatively independent. So I think that's the basic difference that I've felt is there between these different surgical programs. Again, it is something which is very dependent on the person. So, some people can be PGY 2 and be really, really good. And some people just attain that level of confidence at PGY 10. It just really depends on the person too, because it's just that kind of a field. But I think that's one thing which is a disadvantage and then eventually an advantage that I felt. And for that reason, it's like a long road as well. So I think that's pretty much that I would think that is different. Other than that, obviously you get a lot of coverage. I don't know whether Ahmad mentioned in his talk about the Royal College of Surgeons in England gives you a lot of opportunities. The same way the Royal Australasian College of Surgeons gives you a lot of opportunities, for example, for research or for international fellowships or for, studying or courses and even exams. Like you get your on-calls pretty much during your last year become negligible. You get protected time for studying and things like that. And this is all organized by the college. So you get a lot of different incentives in that sense as well. I think that would pretty much be the basic difference. Other than that, all kind of trainings, like I'm sure all of them will have their benefits and disadvantages. Thank you.
Thank you, Dr. Anam. Dr. Sarosh, can you talk about the benefits and drawbacks of training in US?
Yes, so there's both sides. So I'll talk about the benefits first. The thing is, when you train in the US, you're definitely getting a lot of experience with the latest technology. We have already done robotics here. They get you to start developing your laparoscopic skills very early. And in terms of subspecialization, we get to rotate through every single subspecialty. So that helps us decide what we want to do: transplant, vascular, urology, stuff like that. And the other good thing is that in terms of getting a fellowship after this and then getting a job opportunity, it becomes easier as you progress. It's not as hard as applying for residency here. Once you are a resident here, it is easy to get a fellowship, hopefully, if it's not too competitive. It's like Surgeonc, then you have to work extra hard, but usually it's a smooth pathway. And then moving on to get an attending job is also, there are a lot of opportunities here. The bad aspect is that it's becoming so subspecialized. Like, apart from our very old attendings who are near retiring, they'll be doing thyroids, they'll be doing breast together, they'll be doing abdominal surgeries. But then the younger attendings, they only, like, they're so subspecialized, they won't know how to do breast, they won't know how to do any other thing. They'll just be, if there's hepatobiliary, they will only be doing hepatobiliary. So I think, from my opinion, I think that the experiences or the attendings that we had in Pakistan, they were more well-rounded because it's less subspecialized, and you know more, you do more as a single person, but not over here. And then in terms of like how we were talking about training in the UK or Australia, residents aren't as well protected. Like, it's famous that US has a very hard training program for surgery, and for all other surgical programs in all the other countries, you need to have a thick skin. But here, I feel like the residents aren't as protected. You have to be on your own more. Like, there's no maternity leave, there's no study leave, things like that. So I feel like in terms of resident well-being, they have worked less compared to other countries, and I think we could definitely benefit from that. But in terms of training, I think that I get a lot of training here, a lot of operating cases, and you actually can go into whatever field you want to. The other thing I want to talk about is that, but across the US, all the training programs are different. If you are in a smaller program, you may not be able to do as much research or go into the, like, for example, peds surgery is very, very competitive. And there are very few spots in peds surgery. Same for endocrine surgery. There are only like 22 spots of fellowship in endocrine all over the US. So if you're from a small program, you don't have the, number one, the experience in working with endocrine surgeons, and so no contacts. So if you work with bigger programs, you have that. So I guess it varies in Pakistan too in training. So everywhere, it depends on the program you are at. So I think that's all I can say. And the new thing, I don't know if it's a good thing or a bad thing. So in the US now, all the surgery subspecialties are becoming integrated residencies. For example, initially, majority of the residents who wanted to go into vascular would do 5 years of general surgery, then 2 years of vascular fellowship. Now they are vascular residency. So whoever wants to do residency, become a vascular surgeon, you can still do general surgery, but mostly now they're applying into the vascular pathway. So they're not doing general surgery, they're just going into vascular surgery. Same for urology, it's separate now. Same for plastic surgery. So they're like more surgical subspecialty residencies opening across the US. So that's a new change. I don't know if that's a good thing or a bad thing though.
Thank you, Dr. Sarosh. So since we're running kind of short on time, we'll be covering this. I won't be taking the Zoom forum questions, and I'll just be doing this one final question, and then we'll take a question from the audience. So this last question is, with the current public health crises, COVID-19 and systemic racism and all, do you think there will be any changes to the system? And how active is your program towards combating racism and promoting inclusiveness? Dr. Sarosh, would like to start?
Yes, so I think there has been, as everybody knows, there's been a big shift in the US given the current government and the administration. Then they recently passed a law about the students on F1. So they're leaning more towards being unhelpful and decreasing the number of international medical graduates in our country. And that, even though it hasn't really affected me or the residents who are already here or who are coming here yet, but it has created a fear amongst the program directors. And because of this COVID situation, there were so many delays in the visa statuses that they have open spots, not in just surgery, medicine, especially medicine, because most of the people go into medicine. There's so many open spots they're trying to fill in last minute with people who didn't match. So I think the trend is not good because of the current. I hope it changes soon, and I hope a new government comes in. But so far, the fear amongst there are no rules against getting healthcare workers in now, but it has created such a fear that the program directors are now leaning more towards hiring residents who have a green card or who are already settled here because of the rules that are coming out. Like, for example, there was I don't know if it's past it, but there was some news circulating that even amongst the healthcare workers who are not involved directly with COVID care are supposed to not be coming in anymore because they need jobs for their own residents. That doesn't make sense. People are all involved. Even surgery was involved, but just that it is creating a very bad impact on the residents and their programs, because now nobody wants to hire a resident who may potentially not get a visa and never be able to start work. So they're just going to hire people from outside, from inside, sorry. So that's one thing that I feel like is very bad. In terms of racism, I think because of the recent events about the Black Lives Matter movement, I think it has brought a very positive change. And because I live in New York, I work with so many people from so many different places. I'm lucky that I work in a place I don't feel any systemic racism. Our program is very inclusive. Our program has a very diverse population. Even the patients, even the residents, even the physicians, they're from all over Argentina, South America, Asia, like all over. So in terms of that, I don't feel it. And the programs that I've worked in the past, I did not feel it, because healthcare is a field in America which is very, very full of international medical graduates, not only just from Pakistan, but from all over. So I'm lucky to work in a place where they have diverse population, and I don't feel it. And if there is something going on, I think the HR department is very strong over here, and there have been complaints against some attendings, and actions have been taken against those. So I think the programs in the US, or at least the ones in the bigger areas, I don't know about the South though, but in the bigger areas, Northeast, I think racism is a problem that has been tackled well in the past.
Okay, thank you, Dr. Sarosh. Dr. Anam, would you like to add anything from Australia?
With the current COVID situation, it's made a lot of things quite complex. And like Sarosh mentioned, even here, the Australian Medical Association has lowered its requirements to get an APRA registration for IMGs who are currently inside Australia, which is good for the people who've passed their exams and were sitting and waiting for a job. However, because Australia is going to have their borders closed till at least next year, January, if not June, and it's already announced. So anyone coming from outside, it would be hard. It would be hard in the sense that most Australian exams, especially AMC2, you can only give inside Australia. AMC1, there are a list of countries that you can give outside Australia, but that doesn't include Pakistan. So essentially that's an issue. From a protecting trainees perspective, or even employee perspective, Australia has been one of the best in their response to COVID-19, apart from obviously New Zealand overriding Australia. But especially there are 4 states within Australia which currently have no COVID cases, and they've internally opened their borders. So I think most of that is a result of a good healthcare system and the actions that they've taken, and also the fact that the population is not that dense, and they were able to maintain good social distancing, and slightly educated background for people also mattered here as well. So I think a number of factors in that sense. In addition to that, most healthcare units or healthcare networks, here they call them, have supported their employees in terms of mindfulness and mental well-being, and trying to support everyone during that situation with psychological help, or any kind of relaxation meditation type help that they needed, and that was all for free. Most of the healthcare workers, their children went to daycare. The daycares were kept open just for them, and they went to daycares for free, so the government paid for it. So I think that was also something to support all the healthcare workers, and I think they handled the situation really exceptionally well here. How would things be different in terms of racism? I don't think with the COVID-19 situation within Australia, racism is any different from what it was before. However, having said that, like I said, having an IMG come and get into programs here has always been harder than other countries, just because of the number of, the population here, and the fact that, especially in South Australia where I live in Adelaide, it is not a very multicultural city like, Sydney or Melbourne. So I think there are differences in that kind of settings, and that's not any different because of the COVID situation. That's just baseline. That's how it was, and that's how I suspect will remain. However, I do think that they used to get a lot of graduates from Ireland and England coming in and filling out spots mid-year for people who used to resign. There's a lot of trend here somehow, for some reason, for people resigning in the middle of the year, for going for locum jobs, or if they get, onto training programs, they leave a resident job and things like that, which used to be filled up by these UK and Irish graduates, which is not going to happen, at least for next year, in which case there's going to be a lot of opportunity for other people to step in, and especially if you've made contacts here and there, it's slightly easier to get in. And once you're in, like even when you're an AQ graduate, like you are going to outshine other people, because when I started work here, I could do half the work and people would be like, oh wow, you're here like at 6 o'clock in the morning charting, like seeing your patients, and that's just unheard of here. So I think the lifestyle is quite different compared to what we're used to. And I think in that sense, it's an opportunity if anyone thinks that would want to come down this road, even though it's a little bit complicated, it might be something that would be good for them. Thank you.
Yeah. Thank you, Dr. Anna. Dr. Yasser, would you like to say anything from a Pakistani perspective?
Yeah, we welcome all specialties and all the nationalities. There is no restriction for any green card or any other nationality. Everyone from North America, Philippines, Australia, everyone is welcome. Well, and even only your national ID card would do. You don't need to show any other papers. So as far as I think the COVID part applies to me, for the COVID, I think AQ did a very good response, and PGME took very good care of us, to be honest. I think you guys would probably already know this, that all of the working was reduced to 1/5. Elective cases were stopped in the beginning. Then once they even started the on-call residents, only the 2 on-call residents would cover the whole specialty. And we were coming in the earlier part only on the 5th day, and even they had apps where we would check our symptoms, and if you tested, if you felt like you had symptoms, so they would give you testing, and even whoever had exposure or tested out positive was given leaves and everything. PGME was very supportive throughout, to be honest. So in that respect, I would say AKU did a wonderful job. The residents overall were very satisfied. We are almost back to our normal routines now. And the PPEs, unfortunately, which was short for the other hospitals, thankfully in AKU, we never faced that. And that's another positive aspect of working in this institute. Thank you.
I had a thing to add quickly before we moved on. In terms of the changes with the current situation, I just wanted to put it out. Whoever is planning on applying, we talked about having removed the score system from USMLE Step 1. I think, as we were discussing with other residents and our attendings, is just another way to try to eliminate the international medical graduates, because initially all the graduates worked really hard and more than the American graduates to get a good score, and they would get in that program, preferable to the medical graduates from America. But now that it's just pass and fail, they will definitely start accepting their own graduates compared to others, even if you're smarter than them and more qualified than them. So the only thing left is to work on your other extracurriculars and your card and your CV to be able to stand out from the other applicants, because now score is no longer a matter.
Right. So we're still on that COVID and racism question. Dr. Ahmed, since you're back, do you want to add anything before you move on?
I mean, I won't add a lot. It's just a general comment. I mean, lately just following soft code is enough to let you know or get you to the conclusion that things are just for one reason or another getting progressively harder in the US. I mean, like like every once in a while, a bomb just drops about a change in policy from either Trump or the administration or the ECFMG about these steps kind of thing, which just leaves everyone in a limbo. So I mean, if I was to draw one conclusion, uh, it's just that progressively things are getting harder, and it's all about like them dropping a bomb and then everyone running around it to see how you can like somehow evade it and still make it. But if this is a pattern, then things they will continue. And if this is about some thought process behind all of this, then they are going to continue to make things harder for you guys. So just keep your minds open, keep your options open always. As far as COVID is concerned, I think AKU was better than most places in the US. I was in touch with most people there in several different programs. The way they went about the situation, the way they treated us. I mean, instead of like, so there was initially a looming threat of them like maybe deducting our salaries, but they instead started giving us free meals and free iftaris and free series. So I mean, AKU has been pretty supportive like that. So things are changing very fast. It wasn't like this 5 years ago. Whoever is responsible for it, I think they really have a bigger plan that's going to counter this unfavorable track of policies from the US. That's it.
Thank you, Dr. Ahmed. So we're over time and we won't be taking many questions from the audience, except we'll just take one question that is from Hasib Mukhtar. We'll unmute you.
Main question that I had to ask was whether taking step 1 before 22 actually helps us in any way to get a residency in US after 22. Obviously, because it'll be pass and fail after that. Thank you.
I think the earlier you take it, the better. Personally, I don't know if you're planning on applying this year, this September. I'm not sure because they've also moved the date forward for application of the residence. But yes, the earlier you apply, the better, because it's just going to get harder from here. So, and if you still have that score thing, I would say go for it. And hopefully, if you're able to score nice. A good score, they will be able to see it, even though it's just pass and fail at that time, and the earlier apply would give you a benefit.
Thank you. I hope you guys don't mind. I had a second question. It's quite short. So when applying for surgery residency and you go for a preliminary year 1, does it actually carry any risk of you not still securing a residency in surgery?
100%. I did not score mine after my first year. I scored my position after second year. So definitely it doesn't mean that if you're in a preliminary year 1, you are going to get it. It's actually going to get harder. And you have to make sure that when you give your in-training exam in the first year, your percentile is like 90 plus, because it's just that competitive. And you have to make sure, apart from just working hard and staying late, you have to study. So when you apply for surgery, keep in mind that there's a possibility that you're not going to match after first year. And when you apply for a second year prelim, you're not going to be able to be allowed to go back and apply for a categorical PGY1. You're only be going to allow to apply for a categorical PGY2. So as you go along, the options become less and less, just because how that's the ACGME rule or the ESFMG rule, because you can't stay for more than a particular years on J1. So if you're applying in the first year as a prelim, work hard and make contacts, but get a 90% plus percentile, and then you might be able to match.
Right, so I think that's pretty much all of the questions we can entertain right now, since we've gone like over time. Thank you so much, everyone, for coming here today. Thank you, Dr. Sosh, Dr. Yasser, Dr. M, Dr. Anam, for taking the time out to actually answer all of our questions about life as a surgical resident. Just before we end, I would like to call the SIG General Secretary, Shamir Chauhan, to say some closing remarks. Thank you. Shamir, you can unmute.
Hello, can you guys hear me?
Yeah, we can hear you.
Yeah, salam everyone. Thank you so much, Ronica and Masaf, for doing a fantastic job today. And thank you to our audience for attending today's Surgery Saturday. We'd also like to thank all our panelists for taking time out of their busy schedules, and we really appreciate their discussions and advice that have given us plenty of food for thought. We're close to the conclusion of today's session. Manzar will put up a final poll for the evening. Please do fill that out before leaving. And that's it from our end. Stay safe, wash your hands, and take care of yourselves. Bye-bye.
All right. Thank you everyone for attending. You guys are all free to leave.